It's important that you care for and clean your Teneo treatment center in between each patient. Let me show you how to do that right now. The first thing you're going to do is remove the attachments that are going to sterilization, and you're going to wipe down the motors, hand pieces, attachments, and tubings as you normally would. Remove the attachment, wipe this down, and these items will go off to sterilization. Again, in between patients, you only need to do this for the positions that were used. You're going to wipe this down, and so on and so forth with the other instruments. Then you're going to enter the in-between patient cleaning menu, which is the first button here. The CDC guidelines recommend 20 to 30 second purge, so we're set for 20 seconds, and we're going to hit start, which will give us this dialog box. You notice the top row of circles is showing you the doctor's element, and the bottom row of circles is showing you the positions on the assistance element. As I pick up instrumentation, you'll see those circles fill so we know which positions were properly purged. I'm going to go ahead and start by placing the spray vent into the orange adapter. I'm going to place the electric motor into the blue adapter, but first I'm going to open the water channel by turning the water adapter to the left, and I'm going to place that into the adapter. Next position, turn this to the left, place that in the adapter. On my turbine coupler, I have a black ring which I'll turn to the left softly until it stops, and I'll put that into the white adapter. Then I have my ultrasonic. Again, I'm going to wipe this down, send the attachment to sterilization, and I'll place this one into the red adapter. Now I'm going to go to the other side, and I'm going to put the assistance instrumentation into here. I'm going to open my saliva ejector, and I'm going to put it inside one of the white tubes. I'm going to open my HVE and put that here. Push the green button and push the start button over here. While I'm waiting for this 20 seconds to complete, I can go ahead and wipe down the rest of the unit as I normally would, including removing any of these features for the endo procedure and sterilizing these with the rest of my instrumentation. When you hear the double beep, that means that the purge is complete and we're ready to treat the next patient. And that's how you care for your Teneo in between patients.